This is Med School Radio.
It's still raining here in Tokyo. And this is your no-frills version, Med School Radio. We're going to go right into Horner Syndrome, medbullets.com. Here is the snapshot. A 67-year-old man presents to his physician following a right-sided carotid endarterectomy. He reports mild pain at the surgical site, but currently does not have any concerns. On physical exam, there is anisocoria, with the right eye being myotic. There is also mild ptosis on the right eye as well. So let's start with a little definition of the terms. So first I said anisocoria. So what is anisocoria? This is a condition characterized by unequal size of the eye's pupils, which affects 20% of the population. It can be an entirely harmless condition or a symptom of something more serious. Then we said that there is anisocoria with the right eye being myotic. Remember that meiosis is when the pupil is constricted, and mydriasis is when it is dilated. There is also mild ptosis, or drooping of the right eye as well. So the introduction, what is the clinical definition? A neurologic syndrome characterized by ipsilateral meiosis, ptosis, and anhidrosis. Pathogenesis, this can be caused by a lesion anywhere on the sympathetic pathway supplying the head, the eyes, and the neck. And they provide a review of the sympathetic course. So you can look at the illustration on the website. The causes include a Pancoast tumor, Wallenberg Syndrome, syringomyelia, and cervical cord trauma that affects the intermediolateral columns, or carotid endarterectomy and carotid artery stenting, or a carotid dissection. So what is a Pancoast tumor? Pancoast tumor is a lung cancer located at the very top or the apex of the lung. The Pancoast tumor is defined by its location. Pancoast tumors are sometimes referred to as superior sulcus tumors. And they are non-small cell lung cancers. A few are small cell lung cancers. And we also mentioned Wallenberg Syndrome. This is a rare condition in which an infarction or stroke occurs in the lateral medulla. The lateral medulla is part of the brainstem. Oxygenated blood doesn't get to this part of the brain when the arteries that lead to it are blocked. A stroke can occur due to this blockage. And as we are seeing here, it could also cause Horner syndrome. So how does it present? Symptoms and physical exam. As I said, you would see meiosis, which resulting in anisocoria, secondary to unchecked parasympathetic innervation, and ptosis due to impaired sympathetic innervation to Mueller's muscle, which is generally mild, and anhidrosis, which suggests a central or preganglionic lesion. So there we have it, Horner syndrome. Thanks to Med Bullets for that very simple summary. Thanks a lot for that.
This is Med School Radio.